Hi, my name is Stephen Shuffle. I'm here today with Dr. Howell Tiller to discuss with him his experiences with schizophrenia. Dr. Tiller has 25 years experience as a medical practitioner.
Hello, Steve. Good to see you.
Thanks for being with us.
Oh, pleasure. Pleasure.
What can you tell me about schizophrenia?
Ooh, schizophrenia is probably one of the most complex psychological diagnoses that can be made because it presents with a myriad of symptoms, from the most benign, where you might think a person is a little bit eccentric, to the most severe, which is debilitating, where a person can't function in his normal life.
So like crazy old ladies, homeless
yes.
people like talking to themselves on the street?
Sort of like that, yes, yes. But the thing is, you brought up a good point there, is that when we look at psychological pathologies, it's roughly broken down into what we call biologic problems and functional psychoses. And schizophrenia is grouped into those functional psychosis group, which is a small group of diagnostic entities that can't really be diagnosed with lab tests alone. Unlike what we like to do in the rest of medicine, is take blood, examine, and get a diagnosis. The diagnosis of schizophrenia requires not so much lab tests as in-depth psychoanalysis.
How would you recognize if you had schizophrenia or if a loved one has schizophrenia?
Well, very often the person who does suffer from schizophrenia doesn't recognize it because a person can live his life very normally and not be very disturbed by it, the person themselves. It usually takes somebody outside of that realm to recognize schizophrenia. And usually it's a slow progression of symptoms. It's not like getting a fever or feeling of pain that would push a person to make a symptom of this disease. It's usually a gradual progression of functional problems.
So it gets worse over time.
Indeed.
What can be done to treat it? Well, and also like a person who has schizophrenia, what kind of behavior do they exhibit? Would there be like a telltale sign?
Well, like you were talking about earlier, I mentioned earlier, the people who are just totally out of context with their environment, that's certainly the more extreme, and the more uncommon perhaps. But one of the earliest signs of schizophrenia could be like a paranoid state. All of us get paranoid sometimes, thinking that somebody doesn't like them or they're doing something to us, and that passes. But if the paranoia exists to the point where it is chronic or just debilitating for a person's life, then that's a pretty good tip-off, perhaps, for it.
And they're paranoid about other people, or over different people over time. It's not just like a one-time.
It could be one time. Well, not necessarily one time, though. That's what I mean by chronic. It's a continual thing. It could be a cap, of course, one person or one event, but it persists.
It gets worse.
It gets worse, yeah. Very often.
Where can you seek treatment if you believe you have it, or if a loved one has it? Like, how do you get help?
Well, the best place is to ask your general practitioner, your family physician, what the physician might think is the best indication. Because many times they're tied in more closely with mental health professionals that they could refer you or refer the person to. But ultimately, it would lead to either a local mental health place or a psychologist or psychiatrist who is more trained at diagnosing and treating this type of problem. Because the treatment for schizophrenia, and depending on its manifestation, is varied, but it's certainly long-term.
Is it something that you can work yourself out of, like psychologically?
Yeah.
So no matter how hard you try, like your mental effort.
You never cure yourself, but you learn to manage it many times. Yes, without.
So it's possible to lead a normal life in the not so severe cases.
Correct. Absolutely. Absolutely.
Well, thank you for your time.
Oh, pleasure, Steve. Good to see you. Anytime.